What does that do? Well, it allows triglycerides to increase. And you've heard that triglycerides are not healthy. They're not. And then HDL decreases when we sit too long. That's that good cholesterol, HDL cholesterol. I told you exercise helps increase it. Well, of course, it makes sense. Sitting is going to decrease it. And then sitting disrupts our glucose control. So much so that the American Diabetes Association, the ADA, American Diabetes Association, recommends anyone with prediabetes or diabetes to stand up every half hour to stand and move around. If we don't have diabetes, if we have diabetes or prediabetes, we need to do the every half hour. If you don't, what we need to do is stand up every hour and move around every hour at least. I know people have many wearable devices. Some people have like 3 in their arm, but a lot of people have wearable devices, which is great. And they have alarms to get them to stand up. You could also just use your phone and set it for every hour, and that's a reminder to stand up. So there's a lot of ways to help yourself so that you don't fall into sedentary physiology. A lot of research that shows this. I asked if you experience this, if you get a change in your cravings. Well, research has shown that exercise reduces urges for sugary snacks and attenuates urges in the response to stress situation and the cue in overweight people. You know why? That irisin getting into the appetite center in the brain, and also perhaps lactate. All right, let's talk about food, that whole food plant predominant diet. Really, really important. One of my colleagues and friends is Dr. David Katz. He was a past president of the American College of Lifestyle Medicine. We've become good friends. He's a solid thinker, common sense. He looks at the literature. I like the literature. I like the research. I want to understand what research teaches us, as does he. So for many years, he would do a review of the diets that were common at that time. I was with him, heard him speak about 2 weeks ago, and this is from 2014, but he hasn't updated it. And he said he doesn't need to because the diets are pretty much still the same. Low carb diet, low fat, vegetarian, vegan, low glycemic diet, especially right for those that have diabetes, Mediterranean style diet, a mixed balanced diet. This would be a DASH diet. Dietary approaches to stop hypertension. Many physicians prescribe this for patients who have high blood pressure. DASH diet. You've probably heard about it in the news. And then the Paleolithic diet. Some could say this is turned Atkins or keto, but mind you, you could have a keto vegan diet. So there are benefits, as you can see here, health benefits related to each and every one of these styles of eating. So what I like about Dr. Katz is common sense. Let's look at the compatible elements for all these different eating patterns and eating styles. Let's look together. All of them have limited refined starches, limited added sugars, limited processed foods. That's critical. Limited intake of certain fats, especially trans fats, which are banned. And then an emphasis on whole plant foods. Then we get into this with or without lean meats, fish, poultry, seafood, and that's an area of great debate. Michael Pollan said, eat food, not too much, mostly plants. The emphasis at the American College of Lifestyle Medicine, emphasis in most of the research coming out time and time again now, recent research, is to make sure to consume plants, vegetables, fruits, whole grains. Many, many reasons for this: antioxidants, minerals, vitamins, and fiber, which we're going to talk more about. But you can only get these things from plants. One thing everyone agrees on: reduce that processed food. Research comes out regularly showing that servings of ultra-processed food, that's here on the x-axis. When you increase your servings, you increase your all-cause mortality on the y-axis. Now you know what that is: dying from any cause, all causes. So the more ultra-processed food you eat, the more likely you are to die. Very clear that we need to move away from ultra-processed foods. Let's get into data on vegetables and fruits. Most people agree with a plant slant, which is let's get vegetables in. I don't know anyone that says, no, you should not eat vegetables. I mean, do you? Perhaps you do. But okay, maybe in certain situations, certain vegetables, and some people are allergic to certain vegetables. Okay, so certain or fruits. So those would be off the table. But not every fruit and vegetable. So most people, and even my grandma, my Greek grandma came from Vassara, Peloponnese in Greece, and my Norwegian grandma. Eat your vegetables. Eat your vegetables. Now we have the data. This is lifestyle medicine, so we're evidence-based and we look at the data. Now we have the data behind this. What do I mean? Well, British Medical Journal, a meta-analysis of cohort studies following, again, almost 500,000 people, 469,551 participants in the study, found that a higher intake of fruits and vegetables is associated with the reduced risk of death from cardiovascular disease, heart disease, the thing I talked to you about initially that happened to my dad at age 52, which gives me a risk factor for heart disease. No matter what I do, I will always have that family history risk factor. All right. Do I eat my vegetables? Yes. How many? About 8. Why? Well, you'll look. An average reduction in risk of 4% for each additional serving per day of fruit and vegetables. Now, nurses study compared with those in the lowest category of fruit and vegetable intake. That would be less than 1.5 servings a day. I will ask you in your head, you can answer, how many servings of fruit and vegetables do you enjoy each day? Those who averaged 8 or more servings a day, that's what I said I try to do because I look at the research, were 30% less likely to have a heart attack or stroke. Individuals who ate more than 5 servings of fruit and vegetables per day had roughly a 20% lower risk of coronary heart disease and stroke compared with individuals who ate less than 3 servings. So this is a little bit like exercise. Some is better than none. Try to get more and more vegetables in. If you can get up to 8 servings of fruit and vegetable, terrific, terrific. So that now you know my goals, right? All right, let's get to the why of the fiber. You've heard the WHO recommends 25 to 29 grams of fiber each day. Why? Lowers the incidence of type 2 diabetes, heart disease, stroke, and colon cancer. Did you know that? Okay, maybe. How? Because when we eat fiber, then our microbiome, our friendly bacteria, ferment it. They do their job in our intestines. They ferment it. Why does that matter? They create short-chain fatty acids, acetate, propionate, and butyrate. Why does that matter? Because short-chain fatty acids play a key role in regulating our metabolism, immune system, and cell proliferation. So we take in dietary fiber. Our gut microbiome ferments it, creates acetate, propionate, and butyrate. That gets into our L cells, into our system, increases L cell proliferation, increases proglucagon, increases GLP-1, increases PYY. Different factors that influence our energy metabolism, glucose metabolism, lipid metabolism, our level of inflammation. And you know that inflammation is really that simmering factor in cardiovascular disease, obesity, dementia, diabetes, so many chronic conditions. The underlying factor, inflammation. When we have fiber, we get signals through this mechanism right here with the microbiome fermenting the fiber, creating the short-chain fatty acids, getting in through the L cell, and helping us reduce inflammation, and helping our immunity, and helping us prevent cancer. This is why plants, fruits, vegetables, whole grains are so powerful. This is why Dr. Walter Willett and those in the Department of Nutrition at the Harvard Chan School of Public Health recommend a plate that looks like this. 3/4 of it is plants. Yep. Vegetables, fruits, and whole grains. I, like the American College of Lifestyle Medicine, make my whole plate plants because with this healthy protein, I do nuts, seeds, legumes, beans, soy, and then my whole plate becomes plants. In this Harvard Healthy Plate, they say to choose fish and poultry, beans, nuts, and they say specifically limit red meat and cheese and avoid bacon, cold cuts, and other processed meats. You've heard that before. Now, Dr. Willett is involved internationally in the Healthy People, Healthy Planet plate, and that is represented here. I recommend you go to eatforum.gov, Eat Lancet plate, to get more details about that.